You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Piermatti. Dr. Piermatti, welcome to the program.
Thank you, Randy. Nice to be here.
Now, we've said you're an expert on the topic. You're board certified in two things, dental implantology and prosthodontics. What is a prosthodontist, by the way?
Well, prosthodontics is one specialty. There's 9 specialties of dentistry, and prosthodontics is one of them. It's specifically implant, aesthetic, and reconstructive dentistry.
Okay.
Implantology is a discipline which interfaces with that specialty, but is one of the disciplines within the specialty of prosthodontics.
All right, now your center, you do both. I mean, under one roof, you do the surgery.
Correct.
You personally, and then also you do the restorative part.
Correct. I practice at the New Jersey Center for Implant Dentistry. It's a group practice where there are multiple specialists, and my entire activity centers around dental implant reconstruction. I do both the surgical placement of dental implants as well as the final restoration, or in other words, the fabrication of the prosthetic teeth.
You've done over 12,000 dental implants.
Correct.
Is there a steep learning curve with this surgery?
There is. When I first started back in the early 80s, it was difficult for me, and the technology at the time was not what it is today. Now, after all these thousands of implants placed and restored, it's now a very predictable restoration.
So what are the different categories of dental implant patients that you see?
Our facility sees a great deal of very complex cases where patients feel as though they are at a lost cause, and they really are searching for an answer to their dental problems. They might have had.
When you say lost cause, what do you mean? Like their mouth is a mess?
Sure. They might have had a lifetime of dentistry. They might have had they now have a lot of failed dentistry, and they're looking at the prospects of the removal of most, if not all, of their natural teeth, and they really don't like the prospects of complete dentures.
So the question is dentures or dental implants. Can your gums be too bad, though?
Not really.
Dental implants?
Not really. If a patient is suffering from severe periodontal disease, or if they have carious or decayed teeth that are non-restorable, those teeth can be removed, and now you're placing implants into good, clean, healthy bone.
So the disease goes away when you remove the teeth?
That's right. The periodontal disease goes away when the periodontally involved teeth are removed. Another category would be patients who are simply missing one tooth. They might have had that tooth extracted from dental caries or decay, or it might have been congenitally missing.
All right.
Then there might be a patient that might be missing 2 or 3 teeth and simply want to have the replacement of those teeth rather than a removable partial denture.
Okay.
That patient can have dental implants, certainly. Then you have the denture wearer. They might be a recent denture wearer. They have had their teeth removed relatively recently, have had dentures inserted. Because
of the internet, by the way, are these denture wearers, they know about implants, they're going, boy, maybe I should have got implants?
That's right, and they feel as though they've made a mistake. They had their teeth removed thinking they didn't want to do the dentistry necessary to save those teeth. They've now gone to dentures and they feel as though it was a mistake. And they can easily reverse that mistake simply by placing implants and restoring with fixed, or in other words, non-removable teeth.
What about somebody in dentures 30 years?
And then you have the person, correct, and then you have the person who's been in dentures for a number of years.
But don't they, I mean, haven't they lost too much bone at that point?
They do lose bone. However, they still can have implants placed oftentimes.
Okay.
We can place implants, create fixed teeth for them, or we can place implants and do something a lot more conservative to make that removable denture a lot more stable and comfortable.
What about your oldest patient? How old's your oldest patient that you've done?
We've done people in their 80s.
Really? Now, why would somebody 80 years old want to do that?
Well, again,
it seems very painful.
Again, it's not painful. I know it seems hard to believe, but it's not a very painful procedure to place dental implants, particularly in a patient who has a healed gum or healed ridge, and they're going to place a couple of implants to stabilize their removable denture. And those are patients, for example, in their 80s, where we've stabilized dentures with dental implants.
Now, is it true, as little as 2 implants in the lower, give them something snap in, snap out?
2 implants are an excellent option. I can show you that right
Let's
here.
Take a look.
This is a model which shows a lower jaw. This patient has no natural teeth, but yet we've placed 2 implants approximately in the corners here.
All right.
those are the two implant abutments, or in other words, the attachments there.
They're like little snaps?
They're little snaps. There are two receptacles that are placed within the denture.
So that's a denture. I mean, that's a denture.
That's a complete denture. Okay. But instead of that denture being one in which would ride all over the place, that denture goes down.
I feel. Is this accurate? How? So is this about how tight it could be?
Absolutely.
Is that right?
That's how that will be.
Seems like very snug.
Very snug. Gives the patient all that security. It's just two implants. It's an extremely simple procedure.
How soon can they get teeth in an ideal situation?
They can have teeth in approximately 8 weeks from the time the implants are placed.
But in the meantime, they get something.
In the meantime, they can usually wear their denture that they've had. Certainly, they can wear their denture during that healing period. We can load them a little earlier than that, but if you want to be very conservative, 8 weeks is fine, and you can begin loading the patient with the attachments.
Now, okay, well, let's back up just a moment. The people missing one tooth.
Mm-hmm.
Why a dental implant for one tooth, and what does traditional dentistry offer, and why is dental implants, why are they better?
Dental implants oftentimes are a better option for a patient missing one tooth. You don't have to touch the adjacent teeth, for example, if you're going to replace that one. Traditionally, we would prepare or trim down the adjacent teeth to accept caps, and then the replacement tooth would be attached to that. So it would be a three units of crowns. The cap on the one tooth, the cap on the other tooth, and the replacement cap attached to the other tooth.
All right, okay, so with a dental implant, you just give them their teeth back.
Dental implants, you place one implant, you put a cap on that implant, and you don't touch any of the adjacent teeth.
Okay, did some research. About 17 million people are wearing either an upper or lower denture.
Yes.
Does it, I mean, is your thought it starts somewhere? I mean, missing one tooth, is there a bit of a snowball? I mean, is that one tooth, is there any science to show that creates maybe future?
It can, particularly in the back of the mouth, when you begin losing 1, 2 teeth, you start to get some collapse of the bite. Periodontal disease oftentimes comes into play.
So to those people, get dental implants, stop the process.
Absolutely, it'll stop the process and preserve their bite, preserve no shifting of the adjacent teeth.
Okay, these complex cases, I know you brought some pictures. You say you're changing people's lives with dental implants.
These dental implants, is particularly in our center where we're doing large, complex cases, these are life-changing events.
Let's take a look. What are we looking at here?
Well, first patient that you see here is a relatively young man, just had his remaining upper teeth removed with a full upper denture fabricated. He wears a lower partial denture clasping a couple of non-restorable teeth on the lower. Very, very dissatisfied. He can't eat, he can't smile. It affects his life now. 3 times a day he wants to eat and he's uncomfortable.
So he got the denture and just didn't like it?
Doesn't want it at all. So he came to see me, and this was only a couple of months after he had the denture. So the first thing that we did was to set...
What does he say, by the way, on that consult?
He says, I want real teeth. I want to be able to bite into a sandwich, and I can't do any of that with these plastic teeth. So now we see this same individual with permanent jawbone-anchored teeth that he can bite into anything. He's smiling all the time. He's a completely different individual.
Do you see them change in personality?
We see it all the time because not only do we do the surgery, but we do the restorative. In other words, we deliver the teeth as well. So we see that emotion pouring out when the patient gets their new teeth
Can it be emotional for these?
Very emotional. This is
Tell me
emotional.
This. Is this true? This is the way it's done normally, okay? They go to one place for the consult.
Yes.
Maybe one day, and then they go somewhere else for the imaging, another place.
Yes.
And then they go to another place for
They'll have the surgery done somewhere else.
And then they go back to the other place.
Correct.
And you do it under one roof.
In our facility.
Is that rare, by the way, or is that the future? I mean, is that what's happening?
I can't imagine practicing any other way, but it's not that conventional to have it done all in one. All under one roof.
Because people don't like going to the dentist, right?
Nobody likes going. Nobody wants to be there. Nobody wants to take time out of their busy schedule.
But do you hear that? I mean,
all the
people
time.
Actually tell you. I mean, how do they say it?
They really don't want to be here, but they know it's a necessary evil.
All right. Okay. And you're saying this isn't painful. I mean, look. Obviously, there's got to be some pain, but this patient doesn't complain about pain?
No. This patient, we placed all of his upper implants in one visit. He wears his denture the same as he was before. While things heal, same implants placed on the lower. He can wear a lower denture. We'll allow that to heal. And then we do all of the procedures shortly thereafter to give him a full upper and full lower set of teeth. Next case, I like this gentleman very much, about the same age, between 55 and 60 years old. This gentleman presents
wow.
very, very very dissatisfied with this. He doesn't smile. He holds his hand up in front of his face. He's unable to chew his food effectively. He cannot he cannot socialize as well as he should.
How does that happen, by the way? I mean, is that rare? It's got to be rare.
It's a lot more common than you might think. These are patients that are walking around, although that you might not notice this, but we see this all the time because this is the patient that presents to our office.
They just don't smile.
They don't smile. They're very unhappy. They want something done. They want it done as soon as possible.